Welcome to the SiMART Emergency Room Simulator by Walid Barake, Fong, Sonny James, and Viraj Mohan. Our motivation for creating the emergency room simulator was the rising hospital costs seen throughout the United States, with an 8.2% increase in hospital costs and a 5.5% increase in physician costs in the year 2010. We also observed a chronic mismatch between the emergency room staffing and adequate health care, with overstaffing leading to unnecessary salary expenses and understaffing leading to inadequate patient care and losses in hospitals' reputations. The objective of our emergency room simulator is to help you maximize service in your emergency room by reducing patient wait times, prioritizing service based on condition severity, anticipating patient arrivals and staffing ER accordingly, and matching patients to appropriate emergency room staff given their conditions. We would also like to help you minimize your costs by reducing unnecessary salary expenses and finding optimal quantities for resources and staffing. Our product will also allow you to determine ideal patient-doctor matches and identify and eliminate bottlenecks within your system. This is a walkthrough of the events that will occur during the simulation. A patient enters the ER either by walking in or through an ambulance. They are assessed at the triage and assigned a final code. They are matched and served by doctors and nurses, and depending on their final code, are treated further. Let's go into a little bit more detail about the triage assessment. Patients of varying conditions arrive at the ER. Arrival times and condition severity distributions are user inputs. A final code is deduced from the patient's complaint and the triage's evaluation. This final procedure code is also user adjustable. The final procedure code determines the path which the patient follows throughout the ER. It determines the type of care required, the class of doctor required, the nurses required, and the ER resources required.
Now we will talk about the match and serve component of our model. The match and serve component is the crux of our model. This is where we select and assign optimum doctor-patient pairs. We allow different types of doctors to have different bandwidths. That is, a neurosurgeon might only be able to serve 2 patients at a time, compared to a radiologist who could serve 4 patients simultaneously. Furthermore, fatigue and workload are factored into the doctor's serving times, and the model is optimized to minimize doctor workload. As for patients, the ones with more severe conditions are given priority over those with less severe conditions. Patients being brought in by ambulances are given preemptive priority over others. And at each stage, there is a certain probability that the patient's condition will worsen and require further treatment. Here is the homepage to SiMART's web-based emergency room simulator that emulates an emergency room and provides realistic data to how an emergency room operates. To start a simulation, click on New Simulation. Here is SiMART's input page where the user puts in specific data that is unique to his or her emergency room. We have runtime, total amount of nurses, amount of patients nurses can handle, number of beds, resource information, number of each doctor type, amount of patients each doctor type can serve at once, which we call bandwidth, the distribution data of incoming patients, and finally, click here to run a simulation. Here's an example with some inputs, and after, click Run Simulation to get results. This is SiMART's analytics page. From the user-defined simulation, SiMART generates a set of summary statistics and visual representations of the events that have occurred during the simulation. Here you can see some of variables like beds and nurses. And the chart shows the amount of different resources used over a period of time. We chose resources that we thought were important to the analysis of an emergency room. If you scroll down, we have a chart with dual axes that represents total doctor utilization and the amount of time a patient had to wait for a particular doctor type. Within each doctor type, you can see that they weren't fully utilized, yet there was still a waiting time for the patient. So if you scroll back up, we could see that the bottleneck occurs in nurses. There weren't enough nurses to serve the amount of patients that came into the waiting room, the emergency room. So they had to wait because a doctor needs nurses to operate on a patient. One thing cool about our chart is you can highlight certain areas and zoom in to get more specific results of your desire. And it's a very useful tool because then you can closely analyze charts and identify bottlenecks within a emergency room.
As you have seen, our emergency room simulator can offer you many benefits, including real-world validity, being data-driven, which allows you to adapt our product to your needs, its cost-effectiveness, an array of customizable options, and even has a mobile application for those individuals who need to make quick decisions on the go.